Imagine being unable to see or hear throughout this difficult time. Well, tens of thousands of deaf and blind Americans are coming to terms with a new normal during COVID-19, one that's challenging their ability not only to survive, but thrive. Here's ABC's Devin Dwyer.
For most of us, sights and sounds of the COVID emergency have been inescapable.
The number of cases of coronavirus spiking here in the U.S.
This is a terrible experience.
But for some Americans, the scope of this outbreak has been uniquely difficult to face.
My name is Philip Wismer. I am deafblind.
Philip Wismer, a student at Gallaudet University in Washington, D.C., is one of an estimated 40,000 Americans facing COVID-19 while unable to clearly see or hear.
I have not gone off campus since March 18th. I only come out of my dorm to get food, get the mail, and that's about it.
It sounds lonely.
Yeah, it is. Sometimes I do feel lonely. My other friends that are completely blind are feeling very, very isolated.
Deafblind Americans survive by touch, hand over hand to communicate, fingers on Braille signs for mobility, hugs and handshakes to feel connected. Experts say deafblindness is a spectrum. Not everyone experiences complete darkness and total silence. But touch is critical and now comes with significant health risks.
Our way of communicating and our culture, everything relies on touch, and now we're not allowed to touch.
The requirement to stay 6 feet away from other people is actually not safe for me. As a blind person, I need to touch my guide.
And many guides are fearful of being touched and touching back.
Being home alone is a very big issue that we're faced with today. We're talking about all the things that could happen, additional suicides and certain things like that.
28-year-old Tyler Samuel of Nashville, Tennessee, says she's fighting that loneliness, relying on her partner for help with daily tasks. A genetic condition since birth has degraded her hearing and sight.
For my youth, just really worried that I wouldn't find that independence, and when you do find it, you don't want to lose it. And so for it to be kind of chipped away is it kind of lowers your self-esteem.
Samuel still walks to work every day by herself.
This is my now kind of empty walk home.
A pediatric surgery coordinator at Vanderbilt University Hospital. She's a freelance opera singer with dreams of going big. But the pandemic has prompted some soul searching.
I lost a friend a few weeks ago to COVID, and she was very young and in her early 30s. And it kind of prompted me to go ahead and get my advance directive and my will together. It's something that I wanted, like my wishes, to be known.
A trip to the hospital is what many deafblind Americans told ABC News they fear most.
There's an assumption in a lot of medical communities that it's better to be deaf than disabled.
Haben Gurma is a leading advocate for the community.
I would be deeply terrified I would not get communication access, that I would not get the care I needed if I were to get the virus and go to the hospital.
She says it's a fight for equality. The daughter of an Eritrean refugee, Gurma is the first deafblind woman to graduate from Harvard Law School. In 2015, President Obama recognized her as a champion of change.
When I'm asking you the questions today, Haben, you're actually feeling my questions with your fingers.
When you ask me questions, I'm feeling the questions.
With her special Braille keyboard and guide dog Milo by her side, Gurma and an informal network of deafblind advocates are determined not to be forgotten.
It's certainly not sexy to have a disability, and to deal with deafblindness, I think, makes people very uncomfortable generally.
Rebecca Alexander of New York City wants the world to know that deafblind professionals can pitch in too. She's volunteering her services as a counselor to hospital workers on the front lines.
Just knowing that even someone like me, who the community, I think at large, if they knew how limited my vision and my hearing was, they might not consider me as someone they would reach out to for help. And it does feel good to be able to provide that.
Ashley Benton, who coordinates services for the deafblind in North Carolina, says police in rural areas are checking on residents who don't have technology to communicate.
They contacted us, which was beautiful. And so
we were able to work with the officers who have the appropriate PPE to go in and check on this deafblind consumer to make sure that they were safe. It's so important because we're all going through this together.
Near Seattle, deafblind sisters Nancy and Debbie Summer sticking together through it all.
We have to touch each other. Without that, we can't connect at all. I mean, thank goodness we have computers and smartphones so we can talk to each other with friends. And that's so much better than nothing, right, Debbie?
A persistence to stay connected and to contribute to the recovery.
Figure out what you can do to give back and help your community.
The deafblind community raising its voice in its own way.
What are you liking to sing these days?
I love Queen. did all of Bohemian Rhapsody.
And like so many, dreaming of that big escape after COVID.
What I would like to do after this is all over with is take a vacation.
Just thankful for what they still can touch.
I'm just keeping my fingers crossed that everything will be ready to open again and hoping that the COVID-19 decreases.
For ABC News Live, I'm Devin Dwyer in Washington.
Thanks so much to Devin for that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.